Here's some quick ideas to help you treat metatarsalgia or metatarsal pain. Primarily, the pain is felt, usually at the base of the second or the base of the third phalanx, right here at the metatarsal heads. It'll be tender to touch. You might even see a callus formation here. This occurs because of usually lack of pronation of the foot when you walk. So when your foot hits the ground, you should hit on the lateral heel. Your weight-bearing line should traverse the outside of the foot, across the metatarsal heads, and off the big toe. So in that span of your stance phase, the amount of time the foot's on the ground, the weight-bearing line should make it all the way across the metatarsal heads, and you should push off your big toe, which is why your big toe is big. We get into trouble if we don't pronate enough, and you end up pushing off the second met head or the third met head. And there can be tenderness here. There can also be some nerve irritation, and sometimes Morton's neuroma will form from that irritation. So understanding that this is from a push-off where it shouldn't happen, you want to make sure we can get the foot to pronate and get the toes to splay. So I'm going to show you a couple things. First thing is the first metatarsal joint mobilization. One of the reasons why people don't pronate enough is because their big toe does not extend. If you look at the big toe from the side, see, you should be able to get a good amount of extension. Some studies say up to 45 degrees of extension passively, so that when you push off, your toe can give you leverage this way. If people lack that much of toe extension, they will push off the second met head instead. So mobilizing the first toe and getting it to extend normally is key. Here's how to do that technique. You want to stabilize the first metatarsal, and then you want to mobilize with the other hand, grabbing the entire phalanx, first phalanx, in between your thumb and index finger. Then you want to distract, gently distract, and then you're going to do a dorsal glide of the first phalanx to get extension. So sometimes just the act of extending or distracting, will actually give pain relief to that patient. And then what you're going for is a toe extension that yields a stretch down here and not a jam at the top. Okay, so make sure you mobilize by doing a distraction, maintain that distraction, and then do a dorsal glide of the first phalanx. The next technique you want to do is to try to get rid of this toe extension at rest. I'm going to show you the other angle so you can see the smaller toes. So if at rest the toes tend to rest in excessive extension, you can see how this already places the metatarsal heads at more pressure with the ground. This often occurs because of tightness of a muscle, extensor digitorum brevis. Now, how do you know where it is? Have the person extend their toes actively, and you'll see this muscle bulge right here on the lateral foot, just distal to the lateral malleolus. Go ahead and relax. And so there can be a trigger point here. If someone at rest has their toes in extension, you might often see some hammer toes as well, as the toes try to claw to make up for that MTP extension at rest. You might find a trigger point here. So if there's a trigger point here, you can just do digital massage. Again, what we're trying to do is get the resting position of the toes to be in more neutral instead of extension. Okay, so try that, and then you can stretch extensor digitorum brevis by simply taking the toes and flexing. What they should feel is a pull through the dorsum of the foot. You can use a cupping technique to release the fascia of the dorsum of the foot as well. Here's 2 size cups you can use depending on the size of the foot. You want to apply a little bit of lubricant on the top of the foot. Remember, we're trying to release the fascia of the dorsum of the foot as if we're skin rolling it. So you can take the cup, squeeze it, and apply a suction, and then run it up and down in the area of the extensor digitorum brevis. If it's painful, it needs to be done. If it turns a little red, it needs to be done. Okay, another technique you can use to palpate the tendons. of extensor digitorum brevis. They end up on the medial side of the web space of the toes. So if I'm putting my finger in between the web space, this is a great way to stretch. I can palpate on the medial side. The angle's not great here. Here you go. Okay, you can palpate the extensor digitorum brevis tendons on the medial side. Here, is that tender? You'll notice that it's tender always on the medial side of the joint. That's where this tendon attaches. It'll tendon attach here. It'll attach here, right? The opposite sides are not typically tender. Is this one tender here? A little tenderness there. So what you want to do, this is a neat trick you can do to stretch in that web space and massage, is just take your finger and put it in between the web space. And then massage the tendon of extensor digitorum brevis on the medial side. Loosening that up will help the toes relax in the neutral position so they're not so extended. You're already seeing a change in the foot posture here. Okay, that's technique number 2.5. All right, I'm going to show you one more. And this is, again, trying to encourage a splaying of the metatarsals. When your foot hits the ground, it's supinated. The foot bones are all locked up. As it pronates, the foot bones splay, and then they once again regird as you push off in supination. So people that don't pronate enough usually don't have splaying of the toes, and they can develop tightness in the interossei in between the metatarsal heads. So what you want to do is massage in between the metatarsal heads. Again, it tends to be more tender in between the first and second and third metatarsal. And then take your fingers and just spread the metatarsals apart, kind of pulling from the top here to encourage the splaying of the metatarsals, mimicking pronation of the foot. All right, so just to conclude, to get rid of metatarsal pain, you want to mobilize the first metatarsal so that they get adequate extension and can roll to the big toe. You want to check for tightness in extensor digitorum brevis so that the resting position of the toes is not in extension. That will create more metatarsal pressure when they walk. And then you want to massage the tendons of extensor digitorum brevis in between the toes on the medial side of the toes. That's where the tendons attach. You use your fingers to spread the toes, and then you can use cupping to loosen the fascia of the dorsum of the foot, and then you can do a massage technique to encourage spreading of the metatarsals.